Sri Lanka detected its first case of monkeypox on Friday after a 20-year-old man who returned to Sri Lanka from Dubai on the 1st of November tested positive. He had consulted a doctor for treatment due to suspicions that he may have contracted a social disease, and his samples were sent to the Medical Research Institute in Colombo, where it was confirmed that he had monkeypox. He is currently being treated at the National Institute of Infectious Diseases in Colombo. According to the World Health Organization, 68,900 monkeypox cases were recorded across the globe as of the 3rd of November 2022, and only 25 deaths have been reported so far. In July, the World Health Organization declared a monkeypox outbreak across the world.
Perhaps for up to 3 weeks, the infected individuals will start to develop symptoms, something like influenza, we call it flu, with fever and respiratory symptoms, and also swollen lymph nodes. Those are symptoms that start to appear during the early phase of the infection. At that time, one might not know it is monkeypox. But then following those symptoms within 1 to 4 days, infected people will develop a particular rash like pox vesicles, pox lesions in the skin.
If a person returned from overseas within the past 1 month and experienced fever and a rash, especially close to the genitalia and rectum, as well as on the palms and face, we can suspect it has been caused by monkeypox. If you develop such symptoms, it is paramount to seek immediate medical attention. If you develop these symptoms with a recent travel history, we may have to suspect a case of monkeypox. If you are infected, it is important to keep distance from others until you are cured.
ද්‍රෝණද කියලා ඒ වගේ තත්ත්වයක් මතුවෙනවා වහාම වෛද්‍ය ප්‍රතිකාර සඳහා යොමු වෙන්නේ කියලා ඒ රෝගීන්ගෙන් අපි ඉල්ලා සිටින හැම රෝග ලක්ෂණ මතුවෙනවා.
Sri Lanka detected its first case of monkeypox at a time when dengue is also spreading rapidly across the country. Sri Lanka has recorded almost 40,000 more dengue cases so far this year compared to the figure last year. The country has already declared 25 MOH zones as dengue high-risk zones. Piliyandala, Harispattua, Ukwela, Badulla, Kegol and Mavanella are among the dengue high-risk zones. 43.1% of the total number of dengue cases reported so far this year are from the Western Province. Sri Lanka is facing this new issue at a time when the country is already facing a crisis in sourcing medicine and medical equipment. If the authorities import the vaccine soon, we can prevent the spread before it is contracted by over 1,000. We said this during the COVID-19 pandemic. They delayed it back then. Dengue is spiking rapidly. The hospital system is also collapsing. Some hospitals do not have facilities for the surgeries. We need to pay due consideration to this new issue. We are facing issues in the clinics and the wards. The OPD system is facing a collapse. We are experiencing a shortage in several medicine, including paracetamol and Piriton. We're also facing a shortage of some life-saving medication as well. We're also running out of anesthetic drugs. The blood bank may also face a crisis because of the shortage of material necessary for blood transfusion. The failure in the part of the officials to source the necessary materials has put the people's lives at risk. When you cannot carry out tests in the hospital, the patient is requested to do so at a private facility. That will cost them more than 5,000 rupees. The poor patients cannot afford it. The Sri Lankan people are those who benefit from free education and free health care. They should not be allowed to die in the streets. The health sector must be prepared to face this before it is too late.